I knew I wanted to be a physician at a very young age. And when I talked with folks about it growing up, I was often encouraged to consider other professions in healthcare, like being a nurse or a nurse practitioner or a physician's assistant, all because of a perceived idea of a better quality of life for a woman. And those are all incredibly important components of the healthcare system, but I wanted to be a physician. And so growing up in a smaller town, it felt like I was a pioneer. My medical school class was the first class in that medical school to be 50% women. And it felt like we were changing the world. I never considered myself a surgeon. And then I had the opportunity to be in a surgery and realize it is one of the most beautiful aspects of medicine. I don't always find the operating room a very welcoming place to be. There was a study of gynecologic oncologists, so a survey of people in my unique subspecialty just a couple of years ago, and more than 70% of the female gynecologic oncologists who responded to the survey reported sexual harassment in their training or in their early career. And more than 80% of those women chose never to report it or say anything to anyone. And that was both shocking and not at all surprising. A couple of studies recently have actually demonstrated improved outcomes when the same surgeries are performed by female surgeons compared to male surgeons. I mean differences in complications and hospital readmissions and even mortality. That's an important thing to understand. We are still continuing to fight against a preconceived notion that if there's a female in the room, she's not the surgeon.